It is the Cervical Cancer Awareness Month, that is January, and this particular week nationally we are seeing screening ongoing to ensure that we keep cervical cancer at bay. I have talked to various health specialists and they say there is no reason any woman should die of cervical cancer in this day and age, but it takes you to do something on your end to actually keep it at bay. I'm talking about screening. So before we get to the conversation with my panel in studio, let's look at the facts in as far as cervical cancer is concerned in Kenya. First fact is that it is the #2 common cancer in Kenya. It is cervical cancer is the #2 most common type of cancer in Kenya. The second fact you need to keep in mind is that cervical cancer in 2018 was said to have actually killed many people, and it ranked at #2 cause of cancer deaths in the country. And to just make this very realistic, fact #3 is that cervical cancer was actually caused 3,286 deaths in 2018. So those are the numbers we're working with in as far as deaths related to cervical cancer are concerned. And to help us understand how you and I can keep this at bay in as far as screening is concerned, with me in studio, Anne Morira, who is a molecular scientist from Lancet, Kenya. Thank you for your time. And of course, Dr. Jane Wakahe, who is a gynecologist and obstetrician. Thank you, ladies. Now, before we get to it, there is a reason why we've had over and over again women do not do their screening, and I actually went out to the streets to ask some of them why they shy away from doing their screening. Well, I'm told I'll be given those clips in a moment, but Daktari, even as we wait for them, do we have them? All right, then let's hear what the women have to say as to why they shy away from that regular screening that is recommended.
I think 2 years ago.
So uncomfortable and embarrassing sort of, maybe wakituletea.
Akiona ukiambupanda kitanda fanya hivi una feel.
Well, that was just a small snippet of the many women I talked to on the street, but the general feeling is that they prefer not to go for it because of the privacy, the intrusion they feel, and the religious beliefs and also myths around it also are part and parcel of why women do not go for regular screening. And Dr. Wakahe, tell us, why is it important to do regular screening?
It's very, very important. Once screening is done, one is able to tell whether the cervix is changing from normality towards cancer. And it takes many, many years to change from normality towards cancer. So in between, if somebody keeps screening, they'll know and they'll be dealt with before cancer strikes.
Okay. And when you are doing this screening, what exactly are you looking for? What is this that causes cervical cancer?
When we do screening, what we look for, there are 2 tests that actually someone can look for. There are others, but mainly what is advocated for is the Pap Smear, where they look for cervical changes, cellular changes that can happen in the cervix. And then we have an HPV DNA test, where we screen for the presence of HPV virus in the cervix of a woman, so that we can know if someone is at risk of developing cervical cancer.
And when you talk about HPV, are we talking about a specific kind? Because I understand there are over 100 types of HPV viruses.
There are over 100 types of HPV virus, but what causes cervical cancer, there are around 14 genotypes that we screen for, that we call them the high-risk genotypes. And 2 of the most lethal genotypes is type 16 and type 18, where we screen and test for the presence of those genotypes in the HPV DNA test. Okay,
now let's backtrack a little bit. Dr. Wakahe, HPV, human papilloma virus, explain to us what is that and how it's directly related to causing cervical cancer.
Human papilloma virus is a virus. Facts to know about viruses: there is no cure. Another fact is human papilloma virus is sexually transmitted. And human papilloma virus is not transmitted by sexual penetration. It's transmitted by skin to skin, because human papilloma virus lives in the skin of the person who is infected. So even if somebody is keen and using condoms, they are not protected against human papilloma virus. Now, if somebody gets infected by the high-risk human papilloma virus, chances are that in 80% of the time, the person, if they're healthy, will kick off the virus, which is the way the body deals with viruses. Autoimmune, by its own immunity clears it. Now, if it doesn't kick it off in the 20%, then those are the people that risk getting human papillomavirus. I mean, getting human papillomavirus causing the cervical cancer. And that is the 20% are at risk. So when we test for the human papillomavirus, we are testing, do they have that high risk type? In which case they must do a Pap smear if they have that high risk type. But even if they don't, they must still do a Pap smear because it's not all the types that are able to be tested for as yet.
Okay, so what are some of the risk factors that somebody should keep in mind in as far as the HPV virus is concerned? Because as Dr. is saying, some are able to get rid of it naturally, but some of them actually move on to it being cervical cancer.
Some of the risk factors that she has said, it's sexually transmitted. So we advocate for screening of women to actually know if you if you have the virus in your body. As she has said, most of the time women get the virus sexually transmitted. And if you test for the presence of it, you know if you're at risk of progressing to cervical cancer. And most of the time, those who have HPV positive probably have precancerous lesions that can actually be treated.
Okay, all right. And we're talking about HPV. The other day we saw the government roll out the HPV vaccination and everyone was like, thank God I don't have to go for screening. Now, before we touch on the screening, tell us the importance of a vaccine.
A vaccine is something that is given in a little dose to somebody before they get the infecting material. So it's the infecting material that is treated in the laboratory and given to somebody so that they react. We react on it as human beings, and we make antibodies to fight those infective material. So if a vaccine is given, the body is already alert that this infecting material can happen. So if that infecting material does happen, then the body is already ready to fight it. So it raises instead of the 80% that usually kick it off by own immunity, then it raises the chances of it being kicked off almost to 100%.
Okay.
So that's a vaccine. It's given before an infection happens. So it must be given to people before they're exposed to human papillomavirus.
Okay, and speaking of which, this is being given to young girls between 9 and 14. Definitely those hopefully have not yet engaged sexually.
Yes.
But then again, after this girl has been vaccinated, does it mean she doesn't have to do a screening going forward?
Absolutely not. She still has to do a screening. Two reasons. One, even if she is vaccinated, there is no vaccine that is 100%. So she still will need to do screening. And the second one is that it's not all high-risk types of the human papillomavirus that we have yet a vaccine for. So we have a vaccine for about 6 of them, actually 9 out of the 16, 2 of which are very, very critical because 16 and 18 cause about 70% of all the cervical cancers.
Yes.
So we have for 16 and 18, and we have for a few others. But we don't have for all of them. So although we have protected somebody for 70% by immunizing, and not quite 70% because again it's not 100% take on,
yes,
we still have the 30% who will be caused, the other high risk types will cause. So yes, they must go for screening.
So saying that you said it is transmitted sexually.
Yes.
So it takes 2 to tango.
Yes.
Why are the boys not being vaccinated, and should they be vaccinated?
But boys are getting vaccinated in the developed world. They are. They started vaccinating boys around 2011, thereabouts. And it's just that the two reasons why girls first. One is that the commonest problem that human papillomavirus causes, other than warts, is cervical cancer.
Yes.
So that's why we target the girls. And second is that the other cancers, the penile cancer, human papillomavirus is very funny. Causes all kinds of cancers: penile cancer, vulval cancer, vaginal cancer, anal cancer, oral cancer, all of them. But all the others are so little So we target the girls first because the cervical is the biggest. And the second is the cost.
Okay.
Because it really, really does cost a lot.
All right. So now that we're talking about the HPV virus, it is important to do screening. We have emphasized that, but there are two types of screenings here, the Pap Smear and the HPV test. What is the difference between the two, Anne?
The difference between HPV DNA screening and Pap Smear is that HPV DNA looks for the presence of the virus in the body, but a Pap Smear, it looks for cellular changes that happen in the cervix after you've been infected by HPV and that actually progress to form cancer, precancerous lesions in the body. Yes.
And why is it important to actually do HPV tests as opposed to doing a Pap Smear on a regular?
I'll say when you do an HPV DNA screen, you're given a window before you do another test, that is 5 years. But a Pap Smear, the sensitivity is too low that you have to keep on redoing your Pap Smear every other year. Yeah.
Okay, so Dr. what are we saying? With the HPV tests, are we now going back to saying the regular annual Pap Smear appointment can be put aside and we can now use the HPV test?
When somebody is found to have high-risk HPV,
yes,
they will do Pap Smear every year. If they are found to not have the high-risk HPV, that's when they are told to repeat the HPV in 5 years or to do the Pap Smear in 5 years. Because it takes that kind of time for the cervix to change from normal to abnormality. It takes about 5 years. So if somebody has not got HPV, they don't need to really do a Pap Smear until about 5 years later.
Okay.
But if they have HPV, they must do Pap Smear.
Every year?
Every year.
Okay, so they say every day in Kenya, at least 8 women die from cervical cancer. So we cannot stop to emphasize how important screening is. And as we've had from the ladies, they said privacy issues, religious issue, a man or a woman seeing my nakedness, many things that keep them from going for that test. But now we have a HPV Self Test Kit, and Anne is going to show us how this works. And this definitely goes a long way in giving the privacy that most women actually want, but still do the screening, right?
Yes. So, you know, many women keep away or shy away from screening because they feel that they're being intruded to. They don't want to feel the pain because of use of speculum. Some are metal speculums, others are just single use. But the idea of just going somewhere and actually doing your legs for a gynecologist to intrude is, the experience is not pleasant at all. So this is an self-collection kit. It's not a self-testing, but a sample collection kit where someone can actually collect cervicovaginal specimen at home, at the comfort of their home and privately. This is how it looks like, and it's pink in color. Yes. All
right. Now, I must say at this point that I have actually done the HPV self-test, and I got my results, and I'll be telling you more about that in a moment. But I'm curious to know how exactly to ensure that you collect the specimen and do not contaminate it.
All right, so this device was designed by women, for women, and it's specially designed for collecting of vaginal material. So this is how it looks like, and the parts, this is a pink plunger, we have a pink cap, and a transparent casing, and we have very fine bristles that cannot actually harm or scratch your vaginal area, so you can be comfortable about it. So this is how you go about it. It's usually packaged like this. So when you get yours, you make sure that your hands are very sterile. You wash your hands first, and then you remove the brush from the packaging and make sure not to throw away the packaging. And then you hold your index finger and your thumb and you remove the cap and place it somewhere that it's clean. So, and then you assume a comfortable position. When you assume, then you insert this brush in your vagina up to the insertion indicator wings. This shows you how far you can go. Okay. You push the plunger up, and then this device has feedback click sounds that shows you how many times you can collect a sufficient amount of material. So each click sound, it's 1 rotation. So you at least have 5 rotations to do a maximum adequate sample. Then you retract the plunger, and then you cap it. You return the brush in the packaging,
Yes.
and then you send it to the lab for testing.
Okay, so Daktari, this looks very convenient. I used it and it's actually pretty comfortable, very quick to use, and you do it in the comfort of your privacy and then pass it on now to the labs. Is this something that is available to us in a chemist, or do I have to get it from a gynecologist?
Actually, it's available in the pharmacists and chemists.
No, most right now.
Laboratories.
Yeah, laboratories.
Laboratories, yeah.
Okay, so would you advise going forward, if you're shy about going to your gyno, that you look into the next lab and ask if they do have the Hpv Self Test Kit?
Oh yes, oh yes. It's a good checkup, very good.
Yeah.
And it tells you whether you're at risk of cervical cancer or other kinds of cancers, or whether you're at risk of transmitting the same to other people.
Yeah.
So it's a very, very good test indeed.
All right. And going forward, what would you like to emphasize again? As long as you're doing the HPV virus test, what should the lady still come to you as a gyno?
Oh yes, they will still have to come.
Why?
Because again, laboratory is not 100%. We could miss some high risk viruses. But also because the cervical changes are such that, especially, and I must emphasize this, especially in people who are HIV positive, it could take, whereas it takes about 5 years for the lady to change from normality when the HPV hits, it takes about 5 years or so to change from normality to bad changes.
Yes.
It takes about 6 months for the same lady who is HIV positive. They seem to work together. So especially the HIV positive people, they need Pap Smear like routine, whether or not they are self-testing with the DNA or not. But yes, this is a good thing, and it keeps women at peace, and it's a good thing because it will make somebody know that they are not at risk of getting cervical cancer.
Yes.
But they must keep a check on it. If somebody is negative today, they must check again 5 years to come to see if they have high risk. Thereafter, they must keep checking.
Okay.
Yeah.
All right. So how long does the results take after we've given in the specimen to the labs?
The turnaround time is 1 to 2 days after you have submitted your sample for testing, where you get results for the high risk, the 12 genotypes, we pull them together, and then you have type 16 and type 18. We do simultaneous detection.
Okay, and most ladies again are asking, this lab person that I'm giving my specimen, how do I ensure that they do not go talking to every Tom, Dick and Harry about my status?
Okay, when we work in the lab or any other healthcare professional, they have signed confidentiality agreements with the facilities they work from. So from where I work from, most we deal with barcodes. We don't deal with, we give a unique identifier for each patient. So most of the time we don't deal with the patient names, but the unique identifier. And yeah, I think ethically people are not supposed to do that.
And what happens in as far as the follow-up is concerned? So somebody has done it at their privacy, have brought it, and it's positive. What is the follow-up?
Most of the time we hook them up with a gynecologist to help them do further management. We give them interpretation of their results. If they're high risk, we tell them now, we interpret for them, this is now you have high risk HPV detected. Some may want to watch and wait and repeat after 1 year to see actually if it cleared or not.
Okay.
Yes.
And we are insisting on first the screening and also the interpretation from the gynecologist. When it comes to you, what does interpretation looks like? What does it involve?
Once we are told that we have high risk HPV, whichever type, then we will recommend that the lady does a Pap Smear. It's the Pap Smear now that will inform us whether there is need to take any action on the cervix or not. Now, people who are 25 years and below, because their immunity is very good, they can have HPV today and no HPV in a year or two. Their immunity will have kicked it off. That, however, does not rule doing the Pap Smear this space of time when they are kicking off the HPV, because they are not sure that they will be able to kick it off. But you can have HPV positive if you are below 25. In another 2 years, it is actually negative. So because we can catch it just as soon as it catches somebody, and as the body is doing its job to remove it, so we can fight it then, but it may be kicked off.
I'm curious to know, somebody has come, it is positive and it needs urgent intervention. What does intervention entail?
There is actually no intervention. HPV is a virus. Once we find it, we are not going to treat. We're going to wait for your body either to remove it or to stay with it.
If it does stay, what happens?
Now, if it does stay with it, that's where the trouble comes, because if it does stay with it, then it changes the cervix or all the other organs towards cancer. So the interventions we talk about is not to remove HPV. The only intervention about HPV is vaccination, because we'll help to kick off the HPV.
Yes.
But once the HPV has set in the system, there's nothing we can do except to watch whether it is changing those other organs towards cancer. And it's the intervention is checking the cervix to see whether it is changing, and then the intervention is to deal with the changes of the cervix, not with the HPV.
Okay. And Anne, you had mentioned that there's a caveat in as far as who can use the Hpv Self Test Kit.
Yes, it is recommended from the National Cancer Guidelines for women above 25 years of age. If someone is having heavy menses, we tell them to wait until you're done, or if someone is pregnant, we tell them to wait until you've given birth to do the HPV self-test. Yes.
Okay, and so 25 and above is recommended to use. So under that, just go for a Pap Smear?
Yes, and the reason for 25 is because below 25, many women will be able to immunally prevent it.
Okay. Yeah. Now, again, as I started off the conversation that every woman, no woman should succumb to cervical cancer. Screening is one step in ensuring that you catch it early. What do you do as a gynecologist in the confines of your offices to ensure that it does not develop to cervical cancer?
Once the Pap Smear is done, there are stages of Pap Smear. There's a normal Pap Smear, or there is what we call an infected Pap Smear, or there is what we call low-grade Pap Smear, then we call high-grade Pap Smear, then we call now cancer. So in between, from low-grade and infection, that one we sort of treat and watch.
Okay.
Once it hits high-grade, then we have to intervene, or when we get the Pap Smear saying high grade or saying cancer, then we have to intervene. And there are several ways of intervention. Mainly at that stage is operation. We can remove just the area of the cervix that is, there's a specific area that is affected by human papillomavirus in the cervix that changes to cancer. So we are able to actually remove that area. And once that area is removed, one will never get cervical cancer, because that's the particular area where it hits. So between high risk and very early cancer, we can do that. We can remove that bit of the cervix, and the woman remains the same and actually remains fertile and can get babies thereafter.
Oh, excellent. Yes. That is good news, definitely. Yes. So, Anne, even as we seek for the Hpv self-test kits, where can we get them, and are they found in Mashinani?
What we do, we are creating awareness to women all over the country. We're even working with the Ministry of Health to sensitize the women and tell them to increase the uptake and coverage of women who are afraid to go for a Pap Smear, because others know it is very subjective. The results are very subjective, and one can claim that if someone actually scrapes the cervical cells and misses the transformation zone, that actually starts changing because you've been infected to cellular changes, as Dr. said. If you miss the transformation zone, most of the cytologists say that the sample is not adequate for review. So someone can actually be told to repeat it and have the sampling taken from the transformation zone. So that's why we are creating awareness on this, because it shows someone you're at risk of developing cervical cancer. These are available at pathologist Lancet Kenya branches all over the country. We have over 40 branches in the country. You can walk in and ask for your brush.
Okay.
Take it home and bring it back for testing.
All right, we're talking about the Hpv Self Test Kit. Definitely, ladies, a very informative conversation. Anne Murira, who is a molecular scientist at Lancet Kenya, and of course, Dr. Jane Wakahe, who is a gynecologist and obstetrician.